Rotorua. Welcome to the last of the New Zealand Centre for Sustainable Cities talk in the Atamora Auditorium, which has been lovely to see familiar faces who've been with us the whole year. And I think it's very fitting, seeing as that we're coming up to the festive season, to remember those who don't have safe, warm, dry, affordable homes. And we've got the pleasure today to hearing from a group who come from Hamilton to the talk, Carol, and people in, and also Poliata Toa, and then people in Wellington, in the Hekangoranga, but the Housing and Health Research Program. But these are people who have got their own program from the Endeavour Fund in MB, and it's a 3-year program, 4-year program, 5-year program, sorry. 5-year program, of which they're 3 years through. And so we thought it was a suitable time to take stock and to share with you what some of their findings have been. And they will speak to you. And normally I'd introduce, but I know that these people are eminently able to introduce the program. So briefly, speaking first is Carol McMinn, and I'll introduce them individually. They're each going to speak for 8 minutes. She's a data analyst and researcher with the WISE group in Hamilton. Since 2014, she has been part of the genesis of the People's Project, a large-scale homeless service providing a housing service-first approach to support those experiencing homelessness. Drawing on 4 years as a case manager, she's completing her PhD focusing on lost points of intervention in people's pathways into homelessness. This research quantifies the prevalence of those who have experienced adverse childhood experiences as part of their journey. Thanks, Carol.
First of all, I'd like to acknowledge all the brave men and women who have willingly shared their research, their stories with us in order that we understand and understand how to end homelessness in New Zealand, or at least make it rare, brief and non-recurring. So first of all, to give a little bit of context, the People's Project is part of the WISE group, which is a large non-government organisation providing solutions in the health and wellbeing sector, just to let you know where we belong in the, supported by a very well organised group. This is Garden Place in 2014 in Hamilton. That's our main square. It was the perfect storm. There was licensed sale of synthetic cannabis and people were sleeping rough in the CBD. The police and other social services had identified about 80 people who were rough sleeping right in the CBD. And when I first joined the WISE group and walked across the park, there were 2 people living in the main centre. There was also a local campground was closing, and the most vulnerable people in our community were living in that campground. So early on, the WISE group led a joint initiative to help people coming out of that campground to find alternative housing, and that collaboration was so successful that it formed the basis of the steering group for the People's Project. Along with the fact that there were more people sleeping rough in the centre, Hamilton was about to host the Cricket World Cup, so the council had to do something about this issue. Unfortunately, that was the impetus. So they did something quite amazing, really. They brought in the Hamilton Central City Safety Plan. Now, mostly bylaws are very controversial when you're talking about homelessness, but they did 2 things. First of all, they set the boundaries around what was acceptable behaviour and unacceptable behaviour in public spaces. But at the same time, they inaugurated the People's Project so that people had somewhere to go to get some support. As I said, the collaboration has been a major success factor for the People's Project. And in fact, project lead Julie Nelson, who is the CEO of the WISE group, has said that no single organisation has the ability or the resources to solve homelessness alone. And we know that the power of having the key leaders of these organisations, the wheel on the left-hand side, has made a huge amount of difference and changed things and systems immediately instead of waiting for long policy changes to occur. The second part of the success of that joined-up approach has been that our clients have consented for us to talk to all those organisations. In fact, they assumed that we all talk to each other. So there you go. So those two, so successful has been the collaboration that Tauranga, who started up in 2017, has kept that same format. So what is Housing First? This diagram shows the comparison between the traditional staircase approach to homeless alleviation and the Housing First approach. So I'm homeless on the streets of Hamilton, and I have a bit of an issue with alcohol. That's the way I cope with the trauma in my life. I get myself into emergency housing, but unfortunately my inebriation means that I'm kicked back out on the street. So I managed to go back into the shelter, and I stay there for a little while, and they offer me transitional housing. But unfortunately my addiction takes over again, and I'm booted back out to the street. I behave myself, and I'm ultimately offered permanent housing because I've proved I can keep hold of it. That's not Housing First. Housing First has shown that people can come directly from a position of homelessness, and in New Zealand that definition goes from couch surfing to rough sleeping, immediately from a situation of homelessness into permanent housing and remain there. And it's extremely well evidenced that this works, and I can tell you from our experience, about 80% of all people remain in their housing and have done for 5 years. So successful has the program been that it's been rolled out around the country, and the People's Project has been the pilot for that. This particular piece of research is from the National Institute of Demographic and Economic Analysis, and we have Dr. Polly Atatoa-Carr in the audience here. We've worked with 2 universities right from the get-go because we knew it was important to collect the right information so that we could change things positively for people. This particular piece of research is from 600 initial assessments, and showed that 70% of the people we were serving were Māori. So in our community, as in most communities, Māori are overrepresented amongst people shouldering homelessness in our community. It is a picture of inequity. Again, from Nydia's Phase 1 research, we showed that people had high debt. Now, it's well known that debt is a contributor to homelessness. Money gives you choices, but actually 188 people told us that they had over $2 million worth of debt. And when you understand that most of these people are on a benefit, there is little opportunity to pay down that debt. We know that this research from these 2 universities has had a major impact already on the way that homelessness is being alleviated in New Zealand. The research that is going to be shown from Otago is included in the Health and Disability Systems Review interim report. Most excitingly for us, it was also included in the wellbeing budget from this year, so it has already had a major impact, research from this project. How are we doing right now? Well, actually, this is a little bit out of date. We've achieved 796 housing outcomes over 5 years. It's an extremely successful program. Over 1,000 men, women and children have been housed in the 5 years. We're very, very proud of that. We've seen over 2,000 people register for help in Hamilton in 5 years. That's a lot of people still needing help. We know from the 2013 census by Kate Moore et al. That 1,300 people were identified as being without severely housing deprived. But we know we've had over 2,000 people rocking up for help at our doors. On average, our team of 10 support 200 active clients every month. We have 20 people still sleeping rough in Hamilton. I know that because we go out at 5:30 in the mornings to check how many people are out there. We haven't solved poverty, we haven't solved the lack of housing, but certainly Housing First has been a success. I'd like to hand on to our next one.
Next speaking is Jenny Ombler, unforgettable. She's a research fellow at the New Zealand Centre for Sustainable Cities and He Kai and Rotorua. the Housing and Health Research Program. She has worked on urban change and local governance issues as part of the Resilient Urban Futures Program and as part of the Ending Homelessness in New Zealand Housing First Research Program.
Kia ora tātou. Thanks for having me, and thanks Carol for that lovely introduction. So I'm going to be very, very brief. I'm just going to outline our research program to you before I hand over to Brodie, then Clare, and then Neville, who present some results. So the Housing First Research Program is a partnership between ourselves, He Kāinga Oranga at the University of Otago, that's in Wellington, the University of Waikato, so Polly Atatuakara is here, and the People's Project. So this is very much a partnership with people who are on the ground doing the work, and we have worked together right throughout. We were funded by MB's Endeavour Fund, as Philippa said, in 2016, and the program will wrap up in 2021. The purpose of this was really to provide a New Zealand evidence base for Housing First. So there's a very strong international evidence base, but there was no evidence for the New Zealand context, and to promote action on homelessness. I just wanted to run through a little bit of the context, particularly when we wrote the grant. So when we were writing the grant, Housing First was not funded by government, and it is now a nationally funded program. There was a rising homelessness crisis, and I want to point out Dr. Kate Amore, who's in the audience as well, her work on the severely housing deprived population, and the censuses showed that homelessness accelerated between 2001 and 2013. Also, I want to acknowledge that homelessness there is an equity issue underlying this. People who are Māori are disproportionately affected by homelessness. And for this reason, we think it's really important to consider the kind of systemic issues, so things like colonisation, discrimination, the things that really drive that. I'll just quickly run through our research streams. So first of all, we have the IDI research stream, which is the outcomes for people housed. So this is led by Dr. Nevil Pierse, who will speak later on, so you'll hear a bit about that. So this is looking at the People's Project, people who've been housed, what happens to them when they are housed, what sort of outcomes do they have. The risk factors and experiences, so this is led by Dr. Polly Atatuakara at Waikato. So this is working directly with the People's Project data that they collect, and Carol presented a little bit of that, looking at debt. The Takatapui, LGBTIQ and homelessness stream, so there's not a lot known about LGBTIQ and homelessness in New Zealand, so Brodie's going to talk a bit about that in a minute. Transferability, so Housing First is obviously a program that started in the US, and it's travelled sort of all over the world, landed in New Zealand, so Clare Aspinall is going to talk a bit about that in a minute, about how it lands in New Zealand and what that looks like. And Te Tiriti o Waitangi and Housing First, which is led by Dr. Kiri Lawson-Tiaho. So this was looking at really the principles of Housing First and how they relate to Te Tiriti and to whānau ora, so really how this is going to work, and if it will work for Māori. I just wanted to briefly show this. So this is what Dr. Lawson-Tiaho has come up with. So this is a whare oranga model. It's a visual representation of a holistic approach to addressing Māori homelessness. It's an integration of principles of Te Tiriti, whānau ora and Housing First. We have published a paper that goes into depth on this model. The details of that we put up at the end, so I won't speak more to it now, but it would be great if you could read the paper, and feel free to ask any questions about that. So now I'm going to hand over to Brodie. Kia ora.
Brodie Fraser is in the final year of her PhD. She's just come back from Prague, Budapest, where her work was very well received, and she is at He Kāinga Oranga, looking at the intersection LGBTQI identities and experiences of homelessness in Aotearoa.
Yeah, so I'm, as Philippa mentioned, in the final year of a PhD looking at takatapui and lesbian, gay, bisexual, transgender, intersex and queer people's experiences of homelessness. So as a bit of a background, We don't have any New Zealand data at the moment. We're working on census, asking some good questions so we can pull out the data in the IDI to find out what people's experiences are. But at the moment, we're just using international literature, which says that 20 to 40% of people who are homeless identify as LGBTIQ, and LGBTIQ people make up about only 5 to 10% of the general population. So there's a really, really massive overrepresentation of queer people in homeless communities, but we just don't know anything about it, which is a bit of an issue. And the international data also tells us that there's a higher prevalence of wellbeing issues for this group, particularly very high levels of substance abuse, poor mental health, poor physical health, HIV, all those sorts of things. And so, as I mentioned, there's no New Zealand research. There's myself and one other PhD student up in Auckland, Tycho Vandenberg, who are looking at this. But we know that anecdotally a lot of queer people are facing really high levels of homelessness and also issues with WINS, particularly for young queer people. So a lot of young queer people are getting kicked out of their homes by their parents when they come out and ending up homeless. They're going to WINS, trying to get a benefit, and WINS say to them, well, no, we're not going to give you this independent youth benefit because your parents have said that they'll take you home if you stop being transgender or if you stop being queer, which obviously can't really happen. So that's a really, really big problem that's pushing them deeper and deeper into homelessness. But we think that's a historic issue now. We're hoping that it's gotten a bit better. The most recent I've heard of was 2011, but I think a lot of work still needs to be done there. Hopefully you can all read this rather hectic diagram. So this came from a literature review that I published recently, and this is what we know internationally about the intersections of LGBTIQ identity and homelessness. So these are the key themes in the literature, and we've charted them about how they relate to homelessness here and LGBTIQ identity here. And they naturally fell into 3 groups. And the first one we've got up here is proximate causes of homelessness. So that includes issues like poverty, racism, substance abuse, and mental illness. The next middle group here is systems failures in early life. So issues of young people in foster care, issues with their family, discrimination, and sexual abuse. And then the final group we've got down here is experiences while homeless, and that's physical ill health and HIV, shelter inaccessibility, so that includes things like shelters being separated by gender and not having any policies in place for transgender clients, and survival sex and sex work, which is a pretty big experience of homelessness for LGBTIQ people. And so I don't know if you can see them very well, but the arrows show the relationships between them. So some of them are single direction relationships, and some of them, like these ones, are multi-direction relationships. And this is what I was sort of basing my interviews on when I started. So my PhD is 9 semi-structured interviews with people who are currently in Wellington, but there were a really varied group, so homeless in big cities, homeless in small rural towns, all across different decades and different periods of their life. And the main thing that really came out of that was that queerphobia and transphobia directly led to homelessness for all of them. It was a really, really big part of their experience. And quite interestingly, their class background was really varied, so they were sort of all over the show. Some of them were really working class, some of them were really upper middle class. And the main thing that came up from that was that discrimination and systems failures were more pronounced for this group of people than for other people who are homeless. And another really important part of their narratives was community connectedness. So that was the key disruptor of homelessness for them. So that was their found families. Quite a few of them were, actually most of them were really big in voluntary positions and in helping their communities. And for a lot of them, those connections with voluntary organisations lifted them out of homelessness at different periods of their time. And also, surprisingly, church communities were a disruptor of homelessness for one of my interviewees. And but from the other side of that was that they were really big on community connectedness because they didn't feel comfortable accessing services. They didn't feel like homelessness services were for them or were relevant for them. They didn't feel that they were safe in those places. And a lot of that stemmed from the fact that they had really limited trust in institutions that were meant to support them. So they'd had negative experiences with healthcare, with WINS, with all sorts of institutions that were meant to support them, and they didn't get that support they need, which just meant that there was no trust there. They didn't feel like they were going to be supported if they went into these organisations. And several of them also tried unsuccessfully to obtain social housing. They managed to get on the wait list, but they never got into housing. And for those that did get on the wait list, they told me that they really wished that the waitlist took into account the fact that they were transgender or that they were queer, because that was a really, really big barrier to them in finding housing, and there was sort of no acknowledgement of that systemic discrimination that they faced. So that's what I've got so far, and hopefully I'll be wrapping that up soon. And we're also doing a little bit of work using the IDI with one of our colleagues, Maddie White, looking at women's experiences of homelessness and digging into the data and finding more about that. And hopefully in a few years, when we've got some census data, we can do that with LGBTIQ people as well. That's me.
Back to Clare Aspinall, look forward to Clare. She's a PhD student with He Tauranga, researching the transfer and evolution of Housing First in New Zealand. This study is part of the program. Clare has research interests in homelessness, issues with emergency and temporary housing. She did a very good master's in boarding houses, and potential ways to address homelessness in New Zealand. She previously spent 13 years as a public health advisor in housing and homelessness. She's the vice chair of Dwell Housing Trust and has 13 years governance experience in the community housing sector. Can you join with me and welcome?
Thank you very much. Tēnā koutou katoa. 3 years into a PhD. Hopefully I have something that may be of interest to people in the audience. So the topic I've been looking at is the transferability of Housing First, and that's whether or not the successes and the positive outcomes that have been seen overseas from the implementation of Housing First can be repeated in the New Zealand context. So in order to look at this, I've done a case study of the implementation of Housing First in 3 locations. That's Auckland, Hamilton and Wellington. Conducted a literature review, key informant interviews and a document analysis. And the international literature really highlights how to be effective, Housing First, the principles really need to be fully implemented into policy and practice for services to gain those positive outcomes. And that really is very closely tied to resourcing. But also being tailored to meet the needs of the local population who are homeless and have high levels of complex needs. That has to fit into the local context and across multiple organisational settings at different levels, but often requires changing the context and realignment of policy and practice. And often that means realignment of resources, but also relationships. And that requires a significant amount of political buy-in. So my study looked at, how have the principles been implemented in New Zealand, how have they been defined, how have services been designed, and how have they been delivered. But also, what has influenced that process and the implementation process. So that's both the international evidence, but importantly the New Zealand context, and very much the local context of the agencies that are implementing the programme. And there's a wide variety of values and beliefs. There's quite a lot of crossover, but there's also some difference. And the different actors and agents that are involved, and of course the power dynamics that really decides what gets privileged in that implementation process. And I've also looked really through interviews, what have the issues and the challenges been through the implementation process, and what have the success factors been. And it's been mentioned a few times, you know, the New Zealand context really is we are a country that has a history of colonisation, and for the implementation of Housing First to fit the local context, that really does mean a Māori cultural context, and that's really very important. And also the pre-existing resources, and also either the lack of alignment with the principles of Housing First and the current services that we use to address homelessness, which I'm not even sure I would call it a treatment-led system. I'm not even sure I would have really called it a system at all. It really has been a very steep learning for government being involved in this space, really, and funding's only officially by central government been for the last 4 years at any sort of scale. And of course the context, which is Te Tiriti o Waitangi, and at the moment I think at a societal level, but also at an agency and organisation and local level, people are really grappling about what the implementations of, you know, what Te Tiriti means in terms of implementation of services and sharing power and partnership, etc. So the early findings really are most of the issues and challenges broadly relate to the inadequacy and the unreliability of pre-existing resources to address homelessness. And services had done the best they could with the resources that they had, and frequently that is a wide mix of funding sources, and not many of them were long-term or consistent. Also, the challenges around lack of clarity in implementation of the principles of Housing First. You know, what was going to be implemented, who would implement it, and the roles that people would play. And the fragmentation and lack of alignment, really, of the existing system of services, and the lack of alignment of policy and existing funding streams to implement services in accordance with the principles of Housing First. And of course, the lack of real mechanisms in order to implement the housing and support at the scale and intensity required. So the initial issues and challenges for organisations were really related to you going to implement this program, therefore you have to now create clarity, alignment and mechanisms, and that's not an easy feat in a relatively short space of time. So the success factors have been related largely to the new resourcing provided by central government. That has been key for organisations to actually begin to be able to implement a program. And the income-related rent subsidy has been incredibly helpful for that, so that people can afford to live in accommodation, and more accommodation has been made available through the private sector. However, we don't really know what the impact of housing and using housing in the private sector will have for people in the long term, because New Zealand's private housing sector is known to be relatively unreliable and high turnover rates, etc. So we're not really sure what's going to happen there. Other success factors have really been linked to the strengths of the organisations involved in the delivery of Housing First, and each organisation has got strengths and expertise in particular areas, and they're slightly different across all of the organisations, and to a certain extent, if everybody's level of strength in each of the areas required could be brought to the highest level of each of the providers in each of those areas across that system of service delivery, there would be an exceptionally high quality of service delivery, and I think that's something that could be achievable in time, but that's going to require training, it's going to resource and sharing of knowledge and information, and to a certain extent a renegotiation of relationships, a renegotiation of policies, of funding, and an increase in that alignment really with the principles of Housing First. The other thing that's come through very strongly is that for providers delivering Housing First services, they've been able to take the Māori cultural values and beliefs and either improve their current service delivery or Māori organisations have led delivery, and we've got such a provider in Wellington, so they're the only Māori-led housing first provider in the country. So that's an innovation for us. So in the future, really, we need greater systemic alignment to reach the scale and intensity of the response required to address homelessness at the scale we have currently, and that's for people with high levels of complex need. And we need to work towards advancement by Māori as Māori organisations, so that we are, as non-Māori, walking alongside Māori organisations and agencies to take that step forward themselves. So I think really for me that's the main points. So if you are interested to know more, watch out. I hope to submit my doctorate sometime next year. Yeah.
I'll introduce Nevil Pierse, who's the Deputy Director of He Kainga Oranga. He's originally a statistician by training. His work is done in partnership with a wide variety of stakeholders, including government and community organisations, and he's focused on the design and implementation of randomised trials in the home and community. His previous studies, this is a very long introduction.
You know who I am.
It's not me, it doesn't need to know who you are. His previous studies have shown the benefits of efficient home heating and insulation, which was instrumental in the 300 million Ika warm up New Zealand, sounds like an advert for us, and the Heat Smart program. His other previous work has included the HRC
The whole thing.
home injury prevention intervention, which showed that the number of falls after these simple interventions dropped by 27%. And he's currently working on the shelter study, which looks at home interventions to prevent re-hospitalisation of children with respiratory disease. Nevil also leads the Ending Homelessness in New Zealand Housing First MB funded research program, and he's going to tell you some of the baseline results and the follow-up.
So I'm going to be introducing the baseline results from the IDI, and I wanted to talk a little bit about when we started and narratives around homelessness, but to give you context for the question. So some people talk about hidden homelessness or the hidden homelessness population. They're a hard to reach group, which is one of the funding streams we applied under even, that homelessness are hard to reach, and this idea that they're not there or they're not interacting with the system. And then on the other hand, a lot of people describe homelessness as a systems failure, that the systems we have aren't working for the groups, or aren't working for, or sometimes even excluding the groups most in need. So this, we were looking at the population that Carl worked with, and we wanted to look at and see, before they came to the situation where they were rough sleeping on the streets of Hamilton and needed to be housed by Carol and her team with support, what were they like? Were they interacting with services? What did government know? Was this a group that were hidden in the very central plaza of Hamilton, or were they a group of people that were reaching out for help and that the help wasn't being delivered? So to do this, we, together with the People's Project and the people themselves actually were very keen that we take their data and have a look at their story. So we're taking their national health identifier, we took for everybody actually, and the date that they commenced housing, because this is the magic of housing first, and it only works if people are housed. And then we wanted to look at them as an individual, and eventually we want to see, can we change their outcomes and trajectories for health, benefits, justice and tax data, or employment and social benefit data. But we wanted to, that's what's coming in a few years' time, but at the moment, this talk is just about what was their previous story. There's a very interesting disclaimer from Stats New Zealand that you can read at your leisure. This is my view, not Statistics New Zealand's or the government's. So to get people on the IDI, and I wanted to talk about that we only took a very limited amount of data, and we did this in a very easy fashion. We took their name, their date of birth, their national health identifier, From Carol, we got all these, everything came from Carol, in fact, from the date of first interaction and the date first housed. We also looked at the categorization of homelessness type, and this is probably something worth saying here. We looked at, we tried to fit into the American context and the American definitions of chronic, episodic, and transitional homelessness, where these people we felt fit on that scale. And we did that for everybody, and then when we had a look at the data, it was an absolutely useless predictor. There was no good data about how vulnerable the people were, or how they fit, or how they would use the service. So Carol has moved, and I noticed her slides have moved on to the VI SPDAT, assessing vulnerability directly rather than trying to infer it from a time causation thing. So it's 390 people. Like all New Zealand data on homelessness, or like most New Zealand data on homelessness, ours is majority female. This is something that comes across quite strongly. New Zealand is slightly different than the rest of the world, as in when we're talking about homelessness, our typical homeless person is female. They'll be of working age, and in general, they're Maori. This is our typical homelessness population. So are they hard to reach? So this is two groups. This is the 390 group, or the Housing First in teal or green, and then the estimated resident population at the same time, which is how stats have retooled the census. So this is the best estimate of you and me and who was in New Zealand at the time the program was going on. And this is our likelihood of showing up in the various data sets. 92.2% of our Housing First cohort are on the health data set. That's just slightly more than you, me, and everybody else, and the typical New Zealander. They're much more likely to have had an interaction with the justice system, and to be noted on that, and more likely to be in the social development and tax systems. So this is not in any way a hidden group. They are in fact more likely to be interacting with government services than you or me. And they're more likely to be noted and correctly noted with their names, date of births, and correct numbers. So the data sets that we're going to be looking at, the data sets we're focusing on are on the 5 years beforehand. So in the 5 years before, they were rough sleeping and how rough sleeping on the streets of Hamilton. What is their service usage? And then in the year immediately beforehand, were they rough sleeping? Were they interacting with services in that 5 years and 1 year beforehand? Is homelessness preventable? We're going to show really that there's quite stark differences, and that they are across health, justice, and social development, that these three areas in particular have high rates of interactions with the people, and at the end of these interactions, they wound up homeless and rough sleeping on the streets of Hamilton. So this is the main benefit assistance. This is the rates of people on the main benefit. This is the rate for the general, the laser pointer, the dark area at the bottom. That's the rate of the general population in the year zero. Here is the date people were housed, which is the 11th of June 2016 for the resident population. This is the amount of people and the rate of going on the main benefit assistance for the general population. As you can see, it's pretty steady for the amount of the population on the amount of the population on, and the likelihood that you would be on the main benefit assistance. Then this is our Housing First population. They're much more likely to have applied to be on the main benefit and to stay on the main benefit 15 years before they wound up homeless in Hamilton. For the 5 years beforehand, so this is a vastly elevated rate, and this in the 9-10 years beforehand, this is going up until it's at an absolutely atrocious peak at well over 10 times the rate of the normal population for being on the main benefit. This is a group that went in and applied for, often successfully, to get on the main benefit assistance. Then they wound up homeless and rough sleeping in Hamilton. This is the graph for how often they were in our hospitals. It's where even for the general population, we have a slight rise in hospitalisation over the last 10 years. For the homeless population, the rate starts off way, way higher, and then we have this spikes of instances a few years beforehand, and then the year beforehand. They are people who wind up homeless come into hospital at an excess rate, a vastly excess rate. They're vastly more likely to be homeless. Okay, being told to speed up. 5 years beforehand. This is the hospitalised at 3 times the rate. A mental health usage in bed nights. These people are in and out, have a very high rate of contact with the mental health system, and they wound up homeless and living in Hamilton. Likewise, police offences and criminal charges, they're showing up at over 10 times the rate. They do, and I want to stress this, these are people who do try hold down jobs. They are in and out of jobs, and wages and salaries. So they are paying wages and salaries at nearly 1/3 the rate, or they spend 1/3 of the months, but they're much more likely to be on the benefit and to have asked for assistance. These results all spike to a certain extent in the 1 year beforehand. So I want to talk about what we know and what we've discovered. So as a population, these aren't hard to reach. These are in fact easy to reach. This is the group that's showing up at MSD, showing up at police, and showing up in the hospitals and GPs. The system has they have a very high rate of service usage and a very high rate of asking for service usage, because we're looking at the recorded stuff. So this shows that as a system, we have the interactions and the places to prevent homelessness if we try to. So we need to we need to do it. We need to set up a system that actually doesn't wind up with, if you have a high rate of usage, you wind up with rough sleeping. We need to have homelessness as part of the solutions, whether with health, MSD or corrections, that they're asking about and dealing with homelessness. None of their services or populations are better served by being homeless. Where we're going next is a research. We're looking at the outcomes post-intervention, pre and post. What difference has Housing First made? This I often sum up as, is housing part of the answer to homelessness? This is the honest research question. We're digging down more into the different events, and we're doing quite a bit. There's a very elevated rate of traumatic brain injury and detected traumatic brain injury, which Carol had us look for and we found. So that's working together. And we're also comparing this with the Auckland City Mission database, those who they tagged at the same time as being in housing insecurity, but they dealt with the best of the resources they had at the time, which is very much the business as usual case for comparison. So does housing people sustainably with wraparound support work better than what we were doing in 2016 otherwise? Okay. And so thank you very much. All of the things mentioned here are either going to be in doctorates very soon or in published papers. Feel free to cite them. That'd be great. And any questions?